The main risk factors for preventable chronic diseases are tobacco use, lack of physical activity, and excessive alcohol use. The risk factors have caused unpreventable and preventable diseases like disability and death. To reduce these risk factors, prevent diseases or injury before it ever occurs, reduce the impact of a disease or injury that has already occurred, soften the impact of an ongoing illness or injury that has lasting effects. We all need to invest our time and money in improving healthy lifestyle behaviors by increasing physical activity and improving our diet. By doing this, almost 35% of early deaths will be avoided. Our integrative nutrition health specialist, Betty Olayinka Folarin Akinlosotu, aka BOFA, advocates for this every Sunday on Health Corner and nutrition segments showing on Healthy Living with BOFA channel, where she also features professionals on interview with expert segments. Join us every Sunday, 2 p.m. US time, 7 p.m. UK and Nigerian time, 8 p.m. South African time. See you there.
Hello, everybody. I'm Bofa, your host for today's show, Healthy Living with Bofa, interview with expert segment. Welcome to the show, everyone, and thank you so much for joining us again. Yes, this is interview with expert on Bofa show, and our focus is on evaluating the impact of healthcare interventions. Before we get started, let us celebrate our fathers. Let us appreciate all our fathers, husbands, uncles, nephews, cousins, friends, business associates, co-workers, and neighbors. We celebrate you today as you father us. Happy Father's Day to you all. Thank you all for being heroes, fighters, defenders, supporters, companions, and for being tigers in the house. We love you. We still love you. We still do till death do us part. Happy Father's Day to all fathers. Yes, we are on live on Bofa show today. On Bofa Health and Nutrition Talk show, interview with experts. Please begin to share it now. Let's invite our friends and families to join us as our medical experts, schools us on impact of healthcare interventions in the community, in Nigeria particularly. Yes, a strong healthcare system is an essential requirement for a country to order and flourish, which obviously increases the overall health level of the country and early management of health. Yes, let's do this after the break. I'll be right back.
There is this saying that you are what you eat. This is absolutely correct. You see, eating right is when we get all the essential nutrients our body needs from the food we eat daily. And these are minerals, vitamins, fats, healthy carbs, proteins, and fiber. The question we should be asking ourselves is, have I been feeding my body with essential food nutrients? Many people have been advised to stay away from certain food because they are very high in carbohydrates. But study shows your body system needs carbohydrates, which we call energy food. What is important is to go for healthy carbohydrates. Gari Didun is a super cereal that can supply your body system with all these nutrients. Developed by Ajogbe Foods and made from gari, cassava, turmeric, coconut, and lemongrass extracts. The nutrients you get from Gari Didun include healthy carbs, minerals, vitamins, fats, proteins, and fiber. So whether you are super healthy or have some health conditions as diabetes or high blood pressure, the expert nutrition advice is to go for Gari Didun. You can eat directly as snack or soak in water. You will love Gari Didun. Are you hosting or attending an event and wondering over a budget souvenir that will delight your guests and associates? Whether it's your party or you are supporting someone special with gifts and souvenirs, we would like to work with you. At Ajogbe Foods, our focus is on healthy living through the provision of safe, hygienically packaged and nutritionally rich foods. We can customize and package our products: Ajogbe turmeric Gari Didun, Ajogbe white Gari, Ajogbe rice, Ajogbe beans, and Ajogbe honey in sizes and prices you can afford. as souvenirs and gifts that everyone loves. For your special orders, purchase and resale inquiries, contact us today through the following: 292 Murtala Mohammed Way, Yaba, Lagos. You can telephone us or send WhatsApp to +234 705 534 2424 and +234 705 656 5659. For US order, contact Berg and BWM Services at +1347 613 5485. Bringing you Gary Didun.
All right, welcome back from the break, viewers. If you are just joining us, this is Healthy Living with BOFA show, interview with experts. And our guest on the show today is a medical expert, Dr. Muideen Babatunde Olatunji, the Executive Secretary of Oyo State Primary Healthcare Board. Dr. Olatunji, you're welcome on BOFA Health and Nutrition Talk Show, interview with experts. Thank you so much for this expensive time sacrifice to promote health. We do appreciate that. God bless you, sir.
My pleasure. Thank you for having me.
You're welcome. Now, some medical experts like you said that hiring more doctors does not solve the shortage crisis, even though physician shortage remains a constant threat. The question is, what are the other contributing factors to health consumers' lack of access to primary care?
Thank you. Basically, like you said, access to care can be affected by many factors. One, you mentioned the availability of the personnel that actually render services. But there is also the possibility of the fact that there will be challenges because in this part of the world, a lot of health services being procured through out-of-pocket expenditure. Now, the fact that you're going to have a cost attached to your health care service might be an impediment to having qualitative healthcare service. And you know, nobody tend to keep an amount of money aside at home. Now, when I'm sick, this is what I want to spend. So when illness call, they call at a time that you cannot even really predict. So with that one, it creates a kind of difficulty in accessing healthcare services. Then again, when you talk about the facilities itself, the availability of the facility, in Nigeria, challenge access to information becomes an issue when you have an unstable network in an environment where you live. So ditto for healthcare services. When you don't have the facility available within the ward or within the 5-kilometer radius, access become a challenge in such a situation. We have millions of courses like that. And one you actually mentioned is the issue of human resource for health. So if the personnel that will render the service are not actually there, it becomes an Herculean task to assess service in such a situation. We have some communities that are far remote, which are referred to as the hard-to-reach areas. In such places, there is no way people living in that area can actually access healthcare as much as they will desire.
That's true. Wow. Wow. Thank you so much. Now, in the last decade, the US has taken measures to improve healthcare and the consumer experience. However, a recent study shows that only 7% of Americans are satisfied with the current healthcare system. And it was reported in, I think it's 2019, that the healthcare system in the United States is in a state of crisis or having major problems. And this was said by 76% of Democrats and 71% of Republicans in 2017, Donald Trump's first year in office. If this can happen in the US, it can also happen to any government in any part of the world. Now, the question is, are there any problems with the healthcare system today in Nigeria, especially in Oyo State that you reside? And if yes, what are these problems?
If America has advanced, as we can call it, an advanced country of the world, could say that, then definitely the developing nation where Nigeria belongs cannot even say they are living in an utopian society. We are ever evolving and we are moving on to see how we can actually improve what we have. So definitely we have our own myriads of problems, challenges as far as personnel is concerned. The one you mentioned, you talk about health insurance. Health insurance is just on an initial takeoff in this part of the world. It's not yet widely accepted. Most of the acceptance you have as far as health insurance is concerned is in the formal sector. We've not had much acceptance in the informal sector. And the majority of people are in the informal sector. So the essence of health insurance is to ensure that we have a basket fund to procure healthcare services. So if the rate of acceptance for health insurance is very low, then you can rest assured that definitely people that will be using out-of-pocket expenditure will be so much. And with out-of-pocket expenditure, access to care will become a kind of a serious challenge and Herculean task. Here as well, we have problem of accessibility, like you already asked in the initial intro. Most of our healthcare facilities can be compared with what we have in advanced world. We talk about logistics, we talk about the medical equipment, the input that we actually utilize to render the care that the client actually require. So if we have this in low quantum or in poor supply, then it's going to impact on what we are. Unfortunately, we have a lot of human resource that could have been utilized in the system because the system takes little to train doctors, to train nurses, all other care personnel. But unfortunately, as long as they get trained, they are in search of a greener pasture and out of the country. So, unfortunately, Nigeria seems like a producer of human resource for health, and other countries of the world where things are better become the harvester of such a critical part of the healthcare service delivery, and it tends to become a problem for the country. So most of our eggs, most of the brain that we produce here tends to leave the country because why? The poor remuneration doesn't encourage them to stay. The cost of living doesn't encourage them to stay, and the security of future and the job security as well doesn't encourage them to stay. And this will impact on the client that will be on the receiving end of the care and services if they had stayed back in the country. So this tends to rob the country of a lot of investments that they've already made into the sector. And now the other people that never made such an investment are now reaping off the country. So it's quite unfortunate, but that's where we find ourselves.
That's true.
So,
that's true. Thank you so much.
Being able to advance in the world, comparative advantage, advanced world are better off than what we have here.
Thank you so much, Doctor. I'm going to take you back to out-of-pocket healthcare service you mentioned. I want us to talk about your state health insurance scheme. I want to talk about this because I'm pretty much aware that this is a priority for His Excellency Governor Seyi Makinde. I mean, today it is obvious that improving healthcare in your state is a major concern for Mr. Governor. And I really commend him for this. Trust me, I do. Why do I want to talk about healthcare insurance? I want to talk about it because most of our guests from Nigeria always make a reference to medical costs in Nigeria to be an out-of-pocket healthcare service. Some residents, or your state residents say that they don't even benefit from this opportunity. Or your state health insurance scheme. Why others say that they argued that they don't even know that this type of insurance exists in the state. In your state particularly. Can you please tell us more about the health insurance scheme? Let us know who can and how can people benefit from it.
Well, on health insurance scheme, people stand to benefit, and it's not the first time they are benefiting from it. And your state insurance scheme is like a Siamese twins with the primary care service delivery through the basic healthcare provision fund system in the country. And the two are matched together. One, the health insurance in our states commenced some years back with the enactment of the National Health Law that established the primary care board and health insurance agency across the state of the federation. Now, with that one, the state initially invested into it, whereby children under 5 and pregnant mothers were factored into the beneficiaries of health insurance scheme. And this has been on a continuous progressive advantage. Apart from that one, the state government has been able to enroll all civil servants in our state into this scheme. so that there will be a pool fund to cater for every person that will require healthcare service delivery. And the rate at which the information awareness and creation is being rendered in the state is very high. And the awareness on health insurance scheme in your state is very high. Today, I can tell you that one for free. Not only that one again, the state is now having a community health insurance scheme, whereby the community members were now mobilized. I told you initially that most of the first acceptors of this scheme are those in the formal sector. So to get those in the informal sector we initiated the community health insurance, whereby the community were encouraged to form a group or to form a cluster, whereby they can come in and be enrolled into the scheme, even at a reduced cost to drag them in. If a lot of people are coming in, the cost can be lowered, and that will be kind of a motivation for people to come on board and join the scheme. And they will not be so much attached to a particular primary health care in their community, so that within the 5 kilometer radius, you can actually walk in and access healthcare services where you are. And it's pay, you can pay either fee for service or by capitation. To make it encouraging for the facility to be able to render services now and have a lot of proof funds, they give to them by capitations. Then you can be even referred to the secondary healthcare, and fees for service can be charged. And people have been seeing the benefit of this. A lot of people that will have gone for C-section and get it done by paying token as a form of subscription into the scheme. And in the long run, they've seen the benefit. So those that are beneficiary now are the one even becoming the advocate of the scheme for the general member of the community. So with the community health insurance is on the progressive increase. And I can assure you now that the state is having close to almost 1 million lives now into the scheme. That shows is a great improvement from where we started from. So as far as the health system is concerned, health insurance has been on a progressive increase, and the acceptability has been very, very impressive among the people.
So it's for all of your state's residents. It's not only for the workers, right?
No, it's for everybody. And then additionally down with the Basic Health Provision Fund, federal government provided for the vulnerable by the enrollment of those vulnerable into the primary care service, and the fund will be paid by the federal government to the state health insurance scheme.
Wow.
And that one is through the Basic Healthcare Provision Fund, which every state that has the structure on the ground will benefit from. So this means many people that can come into the net of health insurance via this approach as well.
So it's like federal government reimbursing the states to service the masses, right?
Something like that.
Thank you so much. Now let's go to health policy, since that is your area, and I'm sure you also specialize on this perfectly, Doctor. There are lots of policy issues facing primary care in the country today, and this includes US as well. And that means healthcare policy is very important. Now, what major impact does health policy have on health and well-being, and how does it benefit citizens?
Any policy definitely that's on health will generally impact on the people. It will generally impact on the health. And part of the health policy in the country that I mentioned is the one that tends to talk about the, in the past, we don't really have a structured law or policy direction that guides health service or in the country. So in 2014, there was an enactment of the National Health Law, which made way for the strengthening of the primary healthcare services and the strengthening of the health insurance scheme in the country, globally. This was a novel policy through an enactment of the National Assembly, and which every state of the region now tends to domesticate and have it in each state of the federation. So in our state, we have primary healthcare establishment law, we have national health insurance law that guides the policy direction as far as health is concerned in our state. Not only that, the part of the major policy for the state of government of the state is free health policy for the citizenry. And like I told you, many people spend through the out of pocket, and that tends to create a barrier to accessing care. Now, with the free healthcare policy, then people are set to benefit immensely from healthcare because it costs nothing to them. Government will make whatever required for them to access care, and this has a positive impact on them. Then part of the health policy that we have is compulsory immunization for children under 5. against vaccine preventable diseases. And this is a novel policy that says every children in school or before school, the age of 0 to 5, must be able to complete their
immunization.
Part of the policy to impact positively on people is to control the spread of malaria. And that would mean compulsory net distribution into all households. So there will be an enumeration for households, and there will now be distribution of long-lasting insecticide-treated nets. This is a positive policy that tends to reduce the burden of malaria. And malaria burden will reduce the productivity of every individual in the country or in the community. So if you can reverse the malaria prevalence, you can be rest assured that people can be much more productive, then the gross domestic product will be enhanced. So government has a policy to have a free distribution of insecticide-treated mosquito nets. Then part of the policy is to improve on the nutrition of children in school youth, especially. And this one has to do with the warming exercise, school feeding policy, and again you give supplements or vitamin to the in school and the out of school children. I mean, within the school age. This would then be able to enhance their growth and make them much more to be fruitful and be well growth for the future. This is a notable policy. Part of the policy of the government is to control population by saying, can we reduce the number of, or can you space your children that you have? This will be a stone that tends to kill many birds. Now, if you can space your children, then the maternal mortality and morbidity will be reduced. We know that if it is too frequent, if it is too many, the life of that woman is at danger. So there could be an increase in maternal morbidity and mortality. And to be able to reduce this one, then try to encourage child spacing. Child spacing does not say you must limit the number of children that you have, but give adequate spacing to your children, then give them part to the same number of children that you can actually cater for. And this is through by promotion of the family planning services. And by government policy, these family planning services are now rendered free of charge to those that will come as clients for the uptakers. This is a laudable policy, one, to control population, again, to prevent maternal mortality and morbidity, even infant mortality and morbidity, because it's only a healthy mother that can actually nurse children to adulthood. So these are some of the many policies of the government that has been of positive impact on the citizenry.
Wow, this is amazing. This is really, really amazing. And I'm really impressed with what the current governor is doing in your state. Thank you so much, Doctor. Now, Doctor, you and I know what health intervention is to be a combination of activities or strategies designed to assess, to improve, to maintain, promote, and do sort of things to health and among individuals and entire population. Doctor, there is one thing I heard His Excellency Governor Seyi Makinde emphasized on during his campaign and after he won the election, and that is ensuring that health services in the state are evidence-based. Can you tell us what Mr. Governor means by this, evidence-based?
Now, to say we want to run evidence-based healthcare service,
guys,
is that we don't want to act at a spinal reflex. You want to be able to evolve policies, take action from deep reflections. You don't need to reinvent the wheel. You want to see what is working. Can you apply this one and improve upon them? And that's one of the things that I talked about. The federal government has a World Health System. So when this government came on board, what does it say? It said, oh, based on World Health System on which the primary care is resting, what am I going to do? Let me improve on the World Health System. So the state went ahead by selecting one facility per ward. And in our state, we have 351 political wards. So as of today, 351 primary healthcare facilities are being renovated and upgraded. And this is a huge cost.
Yes, it is.
Of money to do. And as I did, I'm talking to you, more than 200 have been completed. Renovated, upgraded fully equipped. This is based on the fact that we know the country is running a World Health System. And these are evidence-based, that to have a sustainable healthcare service delivery, you must have a very strong health foundation. And a strong health foundation is a primary healthcare service delivery. It is upon the primary care service delivery that we are going to build the secondary healthcare and we are going to build the tertiary healthcare. Some cases that need not get to the secondary or tertiary, that needs to be seen at the primary care level, were not being seen because the primary care system were not there. But now they are being strengthened, so people can now come to the primary care system, and the burden on the secondary and the tertiary will now be lessened, and they can now focus on specialized cases to be handled. This is kind of evidence-based that we're talking about. Part of the evidence-based that the state has done is the fact that we know we have poor funding for the healthcare service in the country generally and in the state. And what was done? The state now enacted into a law that every month, 7.5% of the federal allocation to local government, which is supposed to be the custodian of primary care services, will now be devoted to primary care service delivery. And this is novel. No state in the country has done this.
Yes.
So every month, 7.5% is now allocated to primary healthcare service delivery. And from this, you can actually procure drugs, do so many things, and be able to run the system. These are evidence-based. And what evidence there? Can we improve investment in health? And there's been an improvement in the investment in the health sector, and now positive stride based on what we are actually having. Another giant stride we're doing is the one we tag as Tomotia health policy. And what does that do? Is to factor the health of the mother and the child into one, and be able to give an holistic approach to it so that we can reduce maternal mortality and we can reduce infant mortality and morbidity. And then the state can have a good and impressive healthcare indicator. So these are the kind of evidence-based policies that we've been doing and we've been trying to move on.
Wow, this is amazing. It is amazing to me because we in the diaspora, we see to this. We look at it as a special thing that has never happened. When it comes to health, this is my area of specialization, and I really focus on that. That is why I have my foundation taking care of PWD that brings me home every 3 to 4 months to Nigeria to serve them. Now, this program particularly is designed in such a way that people can voice their opinion, sending us questions. Immediately they receive the flyer, the advert flyer that we share with them to tell them who our next guest is and the type of topic we're going to be talking about. And we received a couple of questions. And this one I'm going to throw with you is coming from PWDs. And you see, there was a time governors distributed insecticide-treated net. You mentioned it to people in Ibadan. And this particular community, I mean, persons living with disability, they complained that some of them don't get this net. Some say that they don't even know that maybe they share that and stuff. Can you tell us what the Mr. Governor have in plan for this particular community? I mean, people with disability.
Well, there are factors into our healthcare service delivery, and if you look at everything together, we look at it holistically to ensure that everybody have equitable access to care. And definitely, there's no segregation, there's no stigmatization here now. It means everybody is in the same basket, even including people with disability. To even let you know that they are always thought about when we are doing anything. All those health facilities that I just mentioned to you now, they are being innovated and upgraded. It's provided with a facility that will allow access for those people with disability, people that are on wheelchair. They can actually, there's a ramp attached to each of those PHCs now, so that those people can have easy access to the facility. This kind of a simple structural adjustment was never there before.
Good.
It's based on this the recognition that they are part of the system that has to be provided. And the issue of the insecticide net that you mentioned, it was done in such a way that before the distribution, every household were visited, and women were made the focal point of entry, and they were given cards. And for essence of transparency and accountability, people can only be given net based on the number of cards given to individual or to each household. So if you are unavailable when the card was distributed before, it's because unfortunately you may never get a card, whether you are an able person or a disabled person. the essence was that there was enough sensitization and awareness creation. Once you don't make it available, or people come to your house and you don't open door for them, you don't allow them access to give you card and they give you somebody next door, then don't complain when the eventual, because many people all over with this skepticism that, oh, maybe it is not true, it's not what they are going to do. It was done, eventually they now realize the fact that everybody can have access to this one. They're not complaining, oh, we didn't get this. But even having said that, those that did not get now have access to the facilities. Some nets are still available in the facility, but they can go there and register, especially people that are not some others, can actually have access to this and get after the campaign that we actually conducted. So every person is factored into healthcare service delivery. And part of those people with disability, when we talk about the vulnerable groups for healthcare, for health insurance, people with disability were factored among those that are referred to as vulnerable groups. So the vulnerable groups were already captured by the state. So every person is in the basket. It only requires how many were there, and those that come forward to be able to access the service are the one that will be the first major beneficiary. Thank you.
Thank you so much, Dr. Muideen Olatunji, for joining this esteemed initiative to promote health. I really, really appreciate you for this and for all you have given us, all the information. I'm so happy. I'm so excited to give the information back to the society to answer all the questions that might be going on in their minds. Thank you so much, sir. We do appreciate your time and love for this, your people. The dedication given to this program also means a lot to me. I really, really, really honor and appreciate that. Thank you so much.
You're welcome.
God bless you. Thank you so much for coming.
Thank you.
A good night.
God bless. Cheers.
Okay, wonderful people. Thank you for joining us today. This is where we're going to stop for today. Please join us next week while we bring you more information on health and nutrition. Please don't forget to share this show right now with your network. I remain your host, Bofa, an advocate for wellness. Have a good night, everyone. See ya next week. Good night.
Thank you.